Yeah, so this is basically acronym for premenstrual syndrome. Now, what is premenstrual syndrome? Pre is before, and menstrual is your period. Syndrome is some complex complaints. There are so many things the patient they are usually complaining. So premenstrual syndrome, what these women they say, this is something is quite common, very common. Like if you talk to the 10 women, 8 out of 10 they will tell you they are having premenstrual syndrome. But definitely the severity or the gravity of the situation is different for the different person. Some women they are just having mood swings before the periods, especially in the older age group of the women. Some women they have bloating all over the body, so they
Right.
think they are gaining weight, and there is they think they are getting fatter during just before the periods, just 5 or 10 days before the period they are gaining weight all over the body. It's sort of swollen face, swollen body sort of thing. So they say I'm feeling bloated up. Mood swings, as I said, it's very common. Sometimes they have the craving for some things. Like some women they want to eat a lot of sweets these days. Some women they want to eat something fried materials and all. So the premenstrual syndrome is very complex situation, and if it is little bit like in the mild, we say we can, if we can grade the situation. So if it is in the grade 1, they're having little bit of the changes in their body, little bit of the changes in their mind, emotional changes and all. So then it's fine. But when they are young, these changes are less, and they feel so jittery. They feel they want to fight with somebody. So all these things, they are little less when they are young. But as the body, as the age goes on and they are crossing 40 years, the happy hormones in the body are getting lesser and lesser. So happy hormones are estrogen in the body, which is ovaries, which is coming from the ovary. So if this hormone is getting little lesser in the old age group, ovaries they stop making eggs. It depends on the hormone amount of the hormone secretion depends on the ovarian activity, how much hormone ovaries are giving to us, and how many eggs our ovaries are making in the body. So when this hormone becomes lesser in the body after the age of 40 or 45, then this premenstrual syndrome is becoming horrible, and they really need support. So in the young girls, we say just to allay down the anxiety, just to dismay all these symptoms, to listen music, talk to your friends, take this a little bit of painkiller which is suiting to you. But in the older age group, when we are sure this is because of the hormone deficiency, in such women we tell them to go on hormone support. And we do give, it's not necessary exactly to go on hormone support, because no one would like to take the hormones in the older age group women. There something natural substances in with we are having in the kitchen, like soya bean, which is a very good. They have got phytoestrogen. Phytoestrogen, they are not exactly estrogen hormone, but basically they act like estrogen. So soya bean is one, and we ask them to eat a little bit of soya bean. They should include soya bean in their diet, and we can put them on the substances, on the supplement which have got soya bean into it. So it acts as a phytoestrogen, and they can get relieved with the premenstrual syndrome.